Today we learn about common body surface tumors and masses. Let's look at these two case photos. What do you think is the lump on the skin? Body surface tumors refer to tumors derived from skin accessories, subcutaneous tissue, and other superficial soft tissues. Clinically, it is necessary to distinguish it from tumor-like mass of non-real tumor. The upper one is the scar formed after burn, and the lower one is the protuberant fibrosarcoma of the chest wall. The textbook introduces common body surface tumors and masses, including skin papilloma, skin cancer, nevus and melanoma, lipoma, fibroma and fibromatoid lesions, neurofibroma, hemangioma, cystic tumor and cyst. Let's take a look at these common body surface tumors. Cutaneous papilloma is an epithelial hyperplasia of epidermal papillary structure, which extends to subabdominal papillary shape and is prone to malignant transformation. Papillary wart is an unreal tumor mostly caused by virus, with external papillary process on the surface. Senile pigmented wart is also an untrue tumor. It is more common in exposed parts, often accompanied by pigment. The base is flat, enlarged and broken, and can become malignant. This is senile pigmented wart. The right temporary zygomatic part has pigment on the surface and flat base, which is a typical manifestation of senile pigmented wart. Clinically, we usually use surgical resection and pathological examination to take a clear diagnosis. Skin cancer, commonly basal cell carcinoma and squamous cell carcinoma, is more common in the head, face, and lower limbs. Basal cell carcinoma of the skin, derived from the best cells of the skin or accessories, develops slowly and shows invasive growth with few blood or lymphatic metastases. Those with hyperpigmentation are called pigmented basal cell carcinoma, and their appearance is easily mistaken for malignant melanoma. It often occurs in the head and face and is sensitive to radiation. It can be treated with radiotherapy and can also be removed surgically in the early stage. Squamous cell carcinoma, which can be uncelerated in the early stage, is often secondary to chronic ulcer or chronic sinus opening, often associated with infection and odor. It can local infiltration and lymph node metastasis. Many surgical treatment and regional lymph nodes should be cleaned. It is also sensitive to radiotherapy, but it is not easy to cure. Patients with severe bone marrow infiltration in the lower limbs often need amputation. This is a basal cell carcinoma of the skin near the bridge of the nose on the right face. There is ulceration in the center and dilated capillaries on the surface of the mass. We can choose surgical resection and autologous free skin graft. This is squamous cell carcinoma of the frontal skin. Nevus is a pigmented spot. According to the different levels of nevus cells in the skin, it can be divided into intradermal nerves, borderline nerves, and mixed nerves. Nevus cells are located under the epidermis and in the dermis. They are called intradermal nerves. They are often higher than the surface of the skin. The surface is smooth. There may be sweat and hair, and the malignant transformation is rare. When the nevus cells are located in the base cell layer and extend under the epidermis, they are called borderline nervous, local flat, deep pigment. The nevus cells are easily irritated and are prone to malignant transformation after local trauma or infection. Most of them are in hands and feet, which are invulnerable to trauma. The less common one is located on the eyelid and is called closed nevus. Intradermal nevus and borderline nevus exist at the same time, that is, mixed nevus. When the nevus pigment depends, becomes larger or have itching pain or even ulceration, it is possible to become malignant. Complete resection should be done in time and sent to pathological examination. Incomplete resection or chemical burning is not recommended at present, according to the character and size of nevus. If it is benign and can be burned completely at one time, laser nevus removal can also be considered. However, if it is impossible to ensure that the one-time cauterization is clean or the malignancy cannot be ruled out, it is recommended to complete surgical resection. This is our common skin nevus. If it affects the appearance on the face, grows in the easily rubbed parts such as the palm, plantar, and the prenom, or if it is found that there are deepening and enlargement of pigment or size of itching, pain, and ulceration, it is recommended to seek medical treatment. Melanoma is a highly malignant tumor which develops rapidly and develops faster during pregnancy. If the resection is not complete or injured, centralized nodules and metastasis can occur rapidly. Therefore, extensive resection and treatment should be carried out for malignant melanoma. The surgical treatment is local extended resection. The evil black of the extremities can be amputated. Regional lymph node dissection and immunotherapy can be performed after 4 to 6 weeks. This is a melanoma that occurs on the soles of the feet and the fingerprint tips. Lipoma is a tumor-like substance of normal adipose tissue. It often occurs under the skin of lips and the trunk. The boundary is clear and lobulated. It is soft to touch and can have false capsule, sexy and painless. The growth is slow and can reach a huge volume. The deep part is easy to become malignant and should be removed in time. Multiple tumors are small, often symmetrical, have a family history, and can be accompanied by painful lipoma. This is a subcutaneous lipoma, usually with normal surface skin. Clinically, the nature of subcutaneous mass can be judged by color, Doppler ultrasound, and removed surgically. We learned about skin papilloma, skin cancer, nevus and melanoma and lipoma, fibroma and fibromatous lesions, neurofibroma, hemangioma, cystic tumor, and cyst in the back are left to you to learn by yourself. Now let's look at some case photos of body surface tumors. Fibroxanthoma, protuberant fibrosarcoma, neurofibroma, hemangioma, sebaceous cyst, epidermoid cyst. The general treatment principle of body surface tumors begin biennial tumors are completely removed and the capsule is completely removed. Surgical resection of borderline tumors is the main method. The comprehensive treatment plan of malignant tumor should be formulated according to its stage. Tumor biological characteristics are the key to determine the treatment plan. After class, interested students can refer to the guidelines for the diagnosis and treatment of hemangioma and vascular malformation and the Journal of Tissue Engineering and Reconstruction Surgery for a deeper understanding of the diagnosis and treatment of hemangioma and vascular malformation.